Can you briefly describe what a myofascial release intervention actually entails?
Yeah. You want to go first or want me to?
Yeah. If somebody comes to me and I feel like they need what I guess we would call myofascial release, in that paradigm, which is something that is much more gentle than perhaps laryngeal manipulation, then I will put my hands softly on them and wait. And I think that's about what I can say the intervention is. What am I trying to change? I think that becomes a working hypothesis along. So you can have, so I have had experience with clients who have had breathing difficulty, maybe after childbirth, professional singers, breathing difficulty after childbirth, and so we will then work in the general diaphragm area, palpating up abs, up the ribs, and the breathing will improve as a result of that. I'm not sure that the intervention per se is myofascial. I think actually it's really powerful having somebody both listen to you in the treatment plan that you kind of put together, or the conversation you have with the client, and then put their hands on a problem area for result.
Yeah.
Yeah. You want to add anything to that?
To me, a myofascial release session, intervention, is, to me, I'm broadening it into more of a manual therapy intervention. We're going to do there's some demos when we're done here that may show it in action a little bit better. But to me, if I'm going to sort of start from scratch, it's like you start with their history. I want to know that they've been diagnosed. I want to know that they've seen a specialist. If they're coming to be with a primary and a new voice problem, I don't take that on thinking that as a physical therapist or manual therapist that, it's nothing dangerous. But I send them to their specialist, make sure everything's fine with them, right? Next thing I do is really, I listen. I let them take the time they need to tell me about themselves, tell me about that problem, tell me about how it affects them, what makes it better, what makes it worse. It's the stuff I collect on my history form, and I just allow them to speak that, right? And the way I view myofascial release and manual therapy is different from the way a lot of people view it, where, for instance, some say that until the pelvis is balanced, that nothing will hold, right? But there's other people who say, well, until the feet are properly balanced, nothing will hold. And there's other people who say until C1 is balanced, nothing will hold. Well, if all those are true, then they can't be true, right? Because all of those stories can't be true. So there's times when I do look at posture. I care less about posture than I used to, but I still acknowledge it might be important to the patient. If it's important to them, I'm going to take a look at their posture. But the place I start is where they tell me the complaints are. I don't try and create some far-reaching story that, we find the pain and look elsewhere for the cause. Things might be connected elsewhere, but the first thing I want to do is actually have that person feel validated. And if they tell me there's something going on here, that's where we're going to start a touch-based dialogue, is right here. And that's the way the intervention starts. And in a lot of ways, it proceeds much like you described it. You put your hands on them, and that, in some ways, starts the ball rolling.
Yeah.
We poke and prod in all different ways, and that will show when we do some demos.
We'll do the bits and bobs.
Bits and bobs. Yeah, I have to learn this new language.
I think it's important to say as well that idea of listening. When I'm training therapists in vocal massage, that my lesson 1 is listen. You might be the first, because when people come to you and they tell you something, that is both an honour and a privilege, that they have come to you and they're paying you money, asking for your guidance and for your treatment. And so just sitting there and listening, I will sometimes listen for 20 minutes of the hour appointment. I think that's really important.
Mm-hmm. Yeah, rather than rushing them through that just to get to what you think is the good stuff, you could have just bypassed what's the good stuff and the important stuff.
Yeah.
Yeah, I think that's really important. Yeah.
And I think so for me, working with performers in the West End, it's about taking a vocal history, not just, I had nodules in 2006, but I started my training when I was 14 and I didn't like my singing teacher, but my mum made me go because she was paying a lot of money. And then when I got to do my degree in musical theatre, it didn't feel right, my voice didn't feel right, and then I did my first show and that went really well, and then I won an award, but then I didn't work for 6 months, and so that becomes part of the treatment as well. Not that I can say anything, I'm not a psychotherapist, but just sitting there and listening and understanding that they've gone on a journey, I think, to come to you is really important.
Yeah. And, back in the 90s it was called the mind-body approach. Now the better description is every condition, every person we see, there's biopsychosocial aspects to that problem. And I think as a physical therapist, I was taught more about the biology of what's wrong with the tissue. And with the current understanding with pain science and a lot of other things, most of the times there's nothing wrong with the tissue at all. It could be a remnant of an old injury that the nervous system never really let go of completely, but you've got to look at it in the context of the social environment as well as the psychological past and present, right? So, and again, like you said, we're not psychotherapists, I don't pretend to play one, but it's moving beyond just, it's not just the tissues.